So in this class we will discuss about the community health nursing. Okay, so community health nursing related MCQs. The first question is immunization is a. So among these four options, four prevention types, immunization comes under which type of prevention? Options are primary prevention, primordial prevention, secondary prevention, tertiary prevention. So what is the correct answer? Option A, primary prevention. So immunization is giving the a primary prevention of communicable diseases. Okay, so immunization comes under the primary prevention. So primary prevention, it is a example of prevention of problems before they occur. Okay, so before occurring of diseases we are giving the immunization. So for that it is comes under the primary prevention. So the next one is pap smear. So pap smear, it is nothing but it is a diagnostic method for to find out the cervical cancer. Okay, cervical cancer in the woman. So in the prevention category, this pap smear is come under the secondary prevention. Why? Because we already expected that the patient is having some problem. So in order to reduce the disease or any illness, we are doing the pap smear. So this method is comes under the secondary prevention. Okay, these are the levels of prevention. The next question is father of Indian surgery. Options are Dhanvantari, Charaka, Sushruta and Atreya. So the right one is option C, Sushruta. So Sushruta is a name of father of Indian surgery. The next one is the commonest cause of maternal morbidity in India. Okay, what is a common cause of maternal morbidity? Options are anemia, hemorrhage, abortion, sepsis. So the right one is option B, hemorrhage. So hemorrhage is nothing but postpartum hemorrhage. So due to the lack of delivery knowledge of the healthcare person, otherwise other conditions like mother related. Okay, so for example atony of the uterus and or some of the causes which are caused for the postpartum hemorrhage, and this is the a commonest cause of morbidity is nothing but death rate. Okay, so death rate. So these are the cause of the maternal morbidity in India is the hemorrhage. Option B is the right one. Sorry, that is morbidity is illness rate. Mortality is the death rate. Okay, so previously what I have said that is wrong, sorry for that. And the maternal morbidity is a correct question, but the morbidity is illness. Okay, so postpartum hemorrhage, it's a cause of morbidity in the woman after the delivery. The next question is missed cases are identified by. So in a community the people are suffering with a disease. Okay, so some of the cases are missed in the community. So this type of cases are known by, okay, identified by. Options are active surveillance, passive surveillance, sentinel surveillance, prevalence rate. So which one is the right answer? Option B, Passive surveillance. So passive surveillance is nothing but the data is about the disease of the people are given by the other institution. For example, these are the people. Okay, so these people are having the illness, but directly they cannot come under come to the this surveillance reporter. Okay, but what happened here, so this is the institution. Okay, okay, this is a type of institution. This institution will give the information regarding these people. Okay, so these people will give the uh, I mean the data which is about the people. Okay, so if this institution is giving, it is called passive surveillance. So surveillance is nothing but knowing the cases, identifying the cases. So that is called passive surveillance. And the next one is active surveillance. Active surveillance is nothing but it is a systematically collection of data from the community, otherwise field surveys. Okay, so directly they come to the people and finding the cases. So sentinel surveillance. So this sentinel surveillance is nothing but reporting by the specified units from the defined area. Okay, so these are the sentinel surveillance are nothing but hidden cases. Hidden cases. So these hidden cases are identification of these hidden cases known as sentinel surveillance. So these are the surveillances: active, passive and sentinel surveillance. The next question is the screening of the immigrants. So immigrants are nothing but the people who are coming from the other countries. Okay, other countries mainly in the airports. Okay, so for the infectious disease, so when the people are coming from the other countries, we are screening for infectious diseases. So what is the meaning? Options are mass screening, prescriptive screening and prospective screening, selective screening. The right one is option B, that is prescriptive screening. So prescriptive, option C is the right one, prospective screening. So prospective screening is nothing but it is finding the cases from the a group of people. Okay, so for example 100 people are came from the US. Okay, so among these 100 people, the people may have the 30 members or 40 members like that. So to find out these people among the 100 people, it is known as the prospective screening. The next question is submerged portion of the iceberg represents. So you all know the iceberg phenomena. Okay, so this is the ice and here we have the water. So this phenomena you may all know about. So this phenomena is based on this phenomena the hidden iceberg content. Okay, the portion of the ice which is hidden in the water, it is represents. Options are undiagnosed cases, clinical cases, dead cases, treated cases. So what is the right option? The right one is option A, undiagnosed cases. So based on this iceberg phenomena, the portion of the ice which is hidden in the water, okay, so this portion is known as the hidden cases, otherwise undiagnosed cases. So these portion are find cases. Okay, it is nothing but known cases, otherwise treating cases. The right one is option A, undiagnosed cases. So the next one is, which one is the live vaccine? So among these four vaccines, which one is live vaccine? Option A, DPT. Option B, hepatitis B. Option C, TT, that is nothing but tetanus toxoid. Option D, BCG. So the right one is option D, BCG. So BCG, it is a live vaccine. So live vaccines are, so the live vaccines are, first one is a mumps, mumps and yellow fever, rubella, oral polio. So in this, oral polio is a oral type, and the next one is a and measles, endemic, typhus and TB, and rubella or German measles, influenza, and plague. So these are the live vaccines, and remaining typhoid, cholera, pertussis and rabies, salk, mainly salk polio vaccine is a killed vaccine, but Sabin is a, in oral polio, Sabin is a live vaccine. The next question is, dose of BCG vaccine. Option A, 0.5 ml subcutaneous, 0.5 ml intradermal, 0.1 ml intradermal, 1 ml intramuscular. So which one is the right answer? Option C, 0.1 ml, that is intradermal. The next one is the germ theory. Okay, the germ theory of disease was pronounced by, otherwise developed by. Options are option A, Robert Koch, option B, Hippocrates, option C, Louis Pasteur, option D, August Weismann. So which one is the right answer? Who is pronounced that germ theory? So the right one is option C, Louis Pasteur. So Louis Pasteur is developed the germ theory of disease. So the next question is, best sanitation during cholera outbreak. So outbreak is nothing but when the disease or illness is spread over the all community. So what is the best sanitation method? Options are chemoprophylaxis, mass vaccination, disinfection of stool, provision of chlorinated water. So what is the right answer? Option D. Provision of chlorinated water is the best sanitation method. Why? Because we need to provide the chlorinated water is nothing but filtered water. Otherwise, pathogen removed water. So we need to provide the chlorinated water for the community people.